So our model has had some generalized neck pain, kind of the back of the neck coming down into the upper shoulders. Comes on with gardening, comes on with spending time at the computer. We did do a safety screen, and she is safe to proceed from here. And what we found on exam was that her left rotation was limited. She had to get into left side bend to help facilitate end range left side bend, and she's stiff through the upper thoracic. What we were looking at is a couple of different positional tests, and one of which, just kind of coming on to the transverse processes and looking at how she sits, and Heather actually sits slightly right rotated. From here, we can also look at a positional test and see what she does with movement. And Heather, I'm going to have you kind of tuck your chin, bring your head back, and looking at seeing what happens with her. And what happens as she does that, go ahead and relax, is my right thumb actually moves down and back, and my left stays as it is, indicating that the left facet isn't actually gliding inferior on the left side.
So just to say that that was a positional test of finding where she seemed to lie with its rotated right. But on motion, which is a second test, particularly with her doing axial extension, which is all the extension you need, she's getting more prominent on the right, which is really her sliding into an inferior glide. Therefore, again, not moving on left. So we have two tests there that give us information for a cluster, and all we have to do is go to a third test to identify that. We've already found that flexion is totally normal, so we are interested in that extension problem.
So we did a combined movement where we take her into kind of a side bend sort of a position, extension, and on her right side, there's a lot of movement through the system. When we again look at that left side, doing the same technique, it's blocked and has a very, very different feel on this left side.
So statistically, we have three things that indicate what we thought we should find, which is that it does not go into extension and side bending rotation to the left to some degree, and acting like the mid-cervical, it's probably ipsilateral side bend rotation. So then we're going to do go ahead as a traditional technique of blocking and mobilizing to that level in sitting.
So we're going to try to facilitate that left facet extension, side bend rotation. I'm going to come around. I'm going to get my hand pretty close to that joint line to help facilitate. I'm going to create side bend and rotation into that joint, and then from here, coming down from the top down, moving down into that joint.
Really want to be close with the movement hand, which is above, bringing the superior joint into extension, rotation, side bending. Be close to the blocking finger or movement finger. So that's kind of the key input. A lot of people will want to have their hands up higher, and there's too many possibility of different things happening between the two joints. So again, it's that bringing the hand here really is a simple thing, but very key. And it's awkward in the sitting position, but can be very nice to be able to move quickly through different joints, and again, not have to move people from laying on a table and up to sitting back and forth, which loses time in the clinic.
Okay. And a second technique we were just discussing was actually using both hands to actually help facilitate that facet extension.
And that's going to be pretty good in the technique to use in the thoracic, particularly where you're not worried about too much hypermobility below that you're going to be pushing through. You're going to have a fairly stable base, so you can get more force to get a firm mobilization.